My name is Dr. Gideon Hassan, and as usual, I have my co-host here.
Thank you very
Street
much.
Doctor Clemento.
Don't add the street.
But I thought you've been taking pride in your...
But now, people have elevated me.
To what?
To Doctor.
To Dr.
Thank you very much.
Dr. Clemento Suarez. We are going to talk about common eye conditions that affect the human being. And we have with us a seasoned optometrist in the person of Dr. Victor Amoakun.
Woo! He is the brother of the Ashanti regional minister.
Brother of why?
They are all Amoakun.
Please change your mouth fast. Because that's what I can't do.
Are they?
So because of the same name.
Yes.
In the same name, they are related.
Is he your brother or not?
Okay.
He's not, unfortunately.
Me there is my brother. So, what's up, bro?
Dr. Suarez.
Thank you.
Give me 2 common eye conditions you know of.
Okay. The general one. First of almost.
Okay.
Alukmi.
Alukmi. Okay.
Yes.
What's the English name for Alukmi?
Now look me, you think it's a tree. Look me, look London. I look my place. As I'm talking to this.
Okay, Alukmi.
Alukmi and Apollo.
And Apollo, okay.
Yes.
Dr. Marco, Alukmi is what? Is this strabismus?
Yes, strabismus.
Strabismus.
Eye.
Cross eye, correct. But strabismus?
Yes.
Spell strabismus.
Don't spell it. No.
We are learning.
Okay.
I thought you were a seasoned
Yes.
doctor.
I'm not. It's not for myself. We want to test you. They say you are.
Spell yours. Strabismus.
I didn't know about it.
Okay.
It's who know I can find. So you spell it.
STRABISMUS.
Strabismus.
Alukmi.
Strabismus. You can't change the Alukmi, please.
And Apollo is what?
Apollo is tree.
And Apollo is
Hey, bro.
your medical term for Apollo.
Oh, yeah, me, I don't do medical things.
Beg Dr. Marco to tell you.
I know, but I have a headache. I'm going to you.
Have you heard of acute hemorrhagic
cornea?
No.
But
acute hemorrhagic conjunctivitis. Can you repeat that for me?
Acute hemorrhagic conjunctivitis.
Good.
Acute hemorrhagic conjunctivitis.
But you're right. That's a very common eye condition. Dr. Marco.
Yes.
But why is this long name?
It's a medicine, there's sanity. There are some conditions that are very long.
Okay. Yeah. So these are the 2 common ones.
These are the ones you know.
The most common.
No, the other common ones.
Nobody can beat Apollo.
Yes, Apollo is very common. Isn't
Yes.
I mean, it is seasonal. So as much as it is common, it is not the most. Yes, it is not the most common.
If you beat Apollo, Alukmi is there.
Look with me.
How many people have you seen that have Alukmi?
Please.
I think we should talk about some of the very common eye conditions. If you ask me, I think we should be talking about cataracts, maybe glaucoma, isn't it?
Right.
Yes.
Right.
How are we removing acute hemorrhagic conjunctivitis?
We'll talk about that one at
yes.
later time.
Yes.
But today, I think the focus is on cataract and then glaucoma.
Okay.
Have you heard of cataract before?
Of course.
What is cataract?
It's ete.
Okay.
Yes. Mm-hmm. Something will come and cover the
Charlie.
Something will come out.
Charlie,
the doctor. Bring it out.
When we say cataract, what's the understanding for cataract? Yes. Since you know, I think it's ete, isn't it?
Yes, it is. That's the chi or the Akan name for cataract.
Okay.
Ete.
So what causes that?
All right, but cataract, first and foremost, is the clouding of the normal clear lens of the eye. So let's imagine that the lens of an eye is like that of a camera lens.
Okay.
So cataract is when the lens becomes cloudy.
So sometimes you see, but I said,
Yeah, so the cloudy nature of it is more or less like that of, you know how the clouds look like? That's how vision becomes.
blurred.
Yes, when you have cataracts.
Good. So how we solve it? They use cornea lens to cover your lens, or surgically they can. Oh, you should that you say. Oh, you say.
Yeah.
Not doctor.
No.
Okay, sorry,
But I think we've been clear about the definition for cataract. Where we're saying that.
Make me be a rumble.
That's okay. Now we told you
Okay.
You define cataract.
Good.
What's it then? What's
Cataract is the clouding of the lens.
Yes, so it's the clouding of the normal clear lens.
Normal clear lens of human being.
So the question is that why will someone have cataract? Have you ever seen anybody with cataract before?
I've heard.
Anyone can say just yabodia.
Oh no.
Condition be a
Yes,
but that's not what we want.
So I won't say that.
You don't say it.
Yeah,
Tell me some of the risk factors for cataract. In the street, what have you heard?
Yes, I'm not too sure about, but the few that I've heard is getting too much exposure to light.
Okay, that's one. Okay,
Yes.
that's what you've heard.
Yes,
Okay.
especially with the phone. Nowadays, people watch.
But
phone.
I'm here. He's marking you.
Now yes, Miss. No, on my channel.
Okay, too much exposure to light.
To light.
Yo.
And if you eat certain kinds of food, I've forgotten, but it's one of those spices. If you eat it can affect your eye. Not Gary.
Okay.
Gary, we've cancelled it a long time, but I forgot. I'll tell you. So it's the exposure to too much light and some food.
Okay.
I think Clemento is good.
Good.
Good in that sense. Good in the sense that as much as he's a street doctor, at least he's been able to talk about light. So situate light to sunlight. Because of course,
But he wasn't talking about sunlight.
continuous
We're
exposure.
talking about sunlight. We're talking about light from this.
Nothing
We're
so
we're talking about sunlight. We're talking about light from the screen.
sunlight. Pressure the morning. These are like
Okay. You got it.
Okay.
So, all right. So, what else to be some of the risk factors for
so
cataract?
the most common cause of cataract is age. I've always said that anyone who is age 60 and above will get cataract. So if God blesses you and then you're at age 60, right now, how old are you?
45.
45. So you have about 15
Oh, you're 50
years.
something.
As my man can
You have about 15 years.
Yeah.
Once you get to 60, there's a tendency of you having cataract.
Okay.
Anything that is age related is a natural condition that affects the eye. So once you get to age 60, like I indicated, you are susceptible of getting cataract. Because as you age, the cloudiness happens when some proteins in the lens tends to break down. They clamp together. And so because of the breakage, the lens becomes cloudy and then now there's vision loss. So then you're not able to see as much as you would have been able to see. Second thing is sun exposure. You know, in our part of the country where there's too much sun, day in and day out, the sun is scorching and all of that. We expose our eyes to the sun and eventually you can get cataract. And so Dr. Hassan is wearing a lens. Now, when he's outside, the lens has a treatment. It's called a photochromic. Photo means light.
This one is his own there. It's not like that.
When he's in the sun, do you observe him in the sun?
I will not observe, but he cannot buy it. That.
Oh, why can't
It's a normal life.
No. His has the photochromic.
What's
Photo
that?
means light. Chromic means color.
Okay.
So when he's the sun, the lens, as much as possible, when he's exposed to the sun rays, what happens is that it protects the eyes from all the unbearable radiant energy from the sun. And so then he's not exposed too much to the sun. Because like I said, continuous exposure of the eyes to the sun can cause cataract.
So apart from aging, this continuous exposure can also give you cataract without you getting to 60, right?
Yes. So those are risk factors. Then also trauma to the eye. Yes,
trauma.
eye trauma. Yes, when maybe something. I mean, one day probably you were trying to have an argument with someone, and maybe the person, out of anger, used a stick, hit the eye, and then maybe it hits the lens.
The cornea.
Yes, And then behind the cornea is the lens.
It's a rectum.
So trauma to the eye can also cause cataract. And mostly we call it the traumatic cataract. Yes. Then diabetes. Diabetes has ocular manifestation on the eye. So anyone who has diabetes is also at risk of getting cataract. Then corticosteroids, use of yes, use of
What is corticoid?
use of eye medications like corticosteroids. You know, sometimes even pregnant women, maybe they are feeling unwell. They don't go to the hospital to seek for medical attention. They just go to the nearby pharmacy and then complain to the pharmacist that maybe they need some. Yes, They give them medications that have corticosteroids. They take in the corticosteroids. Eventually, the child
will get corticoid.
Can during the formation, because of the intake of such medications, the child is delivered and then
he already has
cataract. So
what is the corticoid?
It's congenital cataract.
What is the corticoid?
Oh, it's a medication that has steroids.
But wait, I want them to know that
Okay.
if you're pregnant and you're taking these steroids, it will affect the baby. It can affect the baby. And these kind of drugs are called corticoids.
Corticosteroids.
Corticosteroids. What are some of the drugs that?
Saying that when you take these medications, you can give birth to a child, and the child will come out having cataracts.
Yes. Of course.
Yes, and we will not see well, obviously.
Yes.
Yes.
Corticoid.
And then the last thing we can talk about is, have you smoked before?
Yes, of course.
You smoke?
I've smoked before.
When was the last time you smoked?
I don't remember. But I was in my mother's house.
You're in your mother's house. Yes.
Yeah, my mother was
Smoking can also.
I'm smoking.
Yeah. So smoking.
I was often smoky.
So smoking can also cause cataracts.
That one there, I don't. Okay, well, the smoke can go into your eyes.
Yes. So as much as possible, if you smoke, it's advisable that you stop. You may not see the symptoms now, but eventually, like I said, there are some proteins in the lens. Now, those proteins tend to break up. They break down. So the more you smoke, you continue to smoke, then it affects the lens.
So is it the smoke that's causing it or what?
Yes, the smoke is what is causing it. When you smoke, what does it do?
It goes out. The smoke goes up.
It goes out.
Yes.
But it doesn't get inside the body, does it? Or it does?
Sometimes we'll get inside.
Yes. So, there's connection. And so the continuous...
But me, when I'm smoking, I stay out small. Why? It's my mother that gets close to it, but me, I stay far away from it.
Yeah. So, these are the most common causes of cataracts. All right, so I mentioned some risk factors or some causes of cataract. Can you mention, age?
Photosynthesis.
No.
Sun
exposure.
Yes, but so sun exposure.
Okay.
Diabetes.
Good.
Horticulture. Corticoids.
Use of medications like
corticoids. Yes. And
the last one.
Smoking.
Good.
But not my kind of smoking. I don't think my kind of smoking.
Who's smoking? Smoking of fish.
Yes, please.
That's not what he's also talking about.
I don't care. Is it not smoking?
He's talking about smoking of cigarettes. When you smoke cigarettes, it has what we call free radicals.
Yeah, I smoke fish and chicken. My mother will be...
So I think we've been clear
right.
What cataract is about. We've been clear about the risk factors. Especially on this show, when people are watching us, it's the risk factors we want to always drum into the head of the people because mostly that's what they can do something about.
Right.
And if they can do something about it, it can help us. Unfortunately, with age being a major risk factor for cataract, it's almost impossible for you to do anything about it.
Right.
But for other things like...
It's not impossible.
Okay.
They've given you the age limit. If you don't want cataract, when you get to 59...
Suicide.
That's suicide on who?
But it's not everybody that has to get to 60. It can happen at any time. You
Yeah,
can increase your risk factors by even smoking.
Yes.
Yeah, that's what I'm saying for the age one.
Yeah.
Yes. But the others, you can non-modifiable. That's the English I've learned here. Modifiable and non-modifiable.
So what are some of the investigations? I mean, if you want to confirm someone having a cataract, what are some of the things that you can do to confirm? Have you heard of any of those things?
No, that one there. No.
Yes, but even before, then we want to look at the symptoms because
Okay.
obviously, what are some of the signs that would indicate that someone has cataract? First and foremost, you start to experience cloudy vision.
Okay.
Like I said, cloudy vision is more or less like, you see how the clouds look like? Blurred vision.
Of course.
Things appear so blurry that you can't see. Then colors also appear faded. You see your shirt is red, but then it will appear so faded that you might even think it's orange.
Yeah, or pink.
What's the color of my shirt?
I don't know.
Okay.
Oh, yeah, come on, some tube so turquoise
his-
white. Oh yeah, turquoise white.
So his Dr. Hassan's being mauve
Turquoise.
or say purple. When you have cataract, you might even think it's blue because then it might have
So
faded
what
so
color
much.
is it? Remember, yeah, or say when you
Mauve.
become mauve and say or violet or what is it? Or purple. Who name?
So Dr. Hassan's shirt's color being mauve, when you have cataract, it can appear so faded that you might even think it's blue.
Blue.
Yes. So yes, colors appear faded.
Faded.
Then also, when you have any glasses prescription, there will be frequent changes in your glass prescription. Today you are wearing this, you are being diagnosed of a refractive error because obviously you cannot see. You wear these glasses in a space of about 2-3 weeks or even a month. You come back to say you can't see. Then your prescription changes again. You are being given that one about 2-3 weeks or even a month. You come back again. It's also a sign or a symptom to say that you have cataract.
Okay.
Yes. And then diabetes.
Okay.
Diabetes, it has ocular manifestation there. So in all of these things, you want to be sure that, as it were, you are experiencing cloudy vision. Because like I said, cataract is the clouding of the normal clearance of the eye. And mostly when the cataract happens, it's like looking through a foggy window or a dusty car windshield. You see how it looks like?
Yep.
You don't see things clear at all. Yes. So basically, these are some of the symptoms.
But when a child is born, how would you see that the child is having cataract?
Congenital cataract. Oh yes. So mostly you want to shine light onto the eye. Yes. And once you shine light, you see the cloudiness.
Oh, in the eye.
Yes, you shine it. Yes, exactly. By shining light, you clearly see it. Yes, you clearly see that the lens is cloudy. But you see, cataract, as much as this is the leading cause of blindness worldwide, it can be reversed through surgery. So when the child is born,
surgery.
Like what?
Nina Manka. No, I was there. I'm so yeah, that the anyway show.
I don't know surgery. No.
I
mean, him say surgery.
normally kind of finish everywhere. You know.
Dr. Marco has even mentioned something very important. He's trying to say that cataract is the leading cause of blindness.
yes, worldwide.
So I mean that is something that we should not take,
For granted.
especially when it can be reversed.
At all. Yes, it can be reversed. So when the child is born and then he or she has a congenital cataract, it can easily be reversed through the surgery. It is a common procedure that is done, and mostly it is successful.
Yeah.
Yes.
Okay.
What are some of the investigations? That's why I wanted we were going to do about. Is it more clinical, or do you do some few things to see if someone has cataract or not?
Yes, I mean, obviously you want to be able to assess how well the person can see from a distance. And so first and foremost, you do a visual acuity to be able to see if the person can see from a distance. Once you do a visual acuity and then you realize that the person cannot see from a distance, then you want to introduce what we call a pinhole.
Pinhole camera.
Yes.
Yes.
Pinhole will mostly block all the scattered lights for the person to be able to see. Well, when you introduce the pinhole and you realize that the person cannot see, it is not helping. Clearly, it is pathological. Then you know the person has cataract. Yes. But if you introduce the pinhole and then the person can see, then you want to think it's a refractive error, which can be corrected with lenses.
I think there are some myths going around that some foods, like
Yes.
mentioned, can let you have cataract. Gary, I've heard of it.
But now I told you that we've cancelled it.
Which people have cancelled the street?
Yes, because now there's Kivo Gary
Okay, so that one if you
and
eat it,
H Gary.
so
the
this one
two-
if you eat, you will not get.
You will not get.
Okay.
But is
But
there,
if Kivo Gary wants to sponsor us, I can cancel H&H. If H&H is faster, I
then
can
cancel
cancel Kivo.
Okay,
But there are two of them now. If you take it, you will not get.
okay.
Yeah.
So, Marco, is there any relationship between food intake and cataract?
Not at all. Not at all. There's nothing of that sort. With the Gary they talk about, yes, I remember even back in SHS,
Yes.
when you eat a lot of Gary, they
Without
say,
milk.
I'm not seeing well because I ate a lot of Gary. No, I mean, Gary has the preparation, Gary has some cyanide. And so when it is when it is not prepared well, then it can have some effects, but not directly related to that. Not at all. Not at all.
Gary is prepared from cassava.
Yes.
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 But
And it has-
one thing I know about cassava relating to a medical condition is not necessarily cataract or eye condition. It contains what we call a goitrogen. And
That's what I'll tell you, man.
that one can predispose you to having what we call a goiter.
And plus,
The symptoms now, I said just about two. Let me add.
Okay, you can add more. Yeah.
There may be. So, I mean, apart from cloudy vision and of course changes in eyeglass prescriptions, then sometimes and colors appearing faded. Sometimes too you can experience double vision in just one eye. Yes.
but that one is good.
Yeah. So, how is it good?
If you see things too. Oh my God.
Have you experienced that before?
No, I wish I would.
You wish you would experience. It's a terrible thing to experience. Don't ever,
And one
Wish for that.
don't ever wish for it.
Do you know this woman, Jocelyn Duma?
Yes.
If you see her, you are seeing her too, don't you like?
So double. So yes, double vision in one eye. Then sometimes glare. You know how when you are driving at night, the glare that comes from oncoming vehicles, sometimes they can appear so bright. Those are some of also the symptoms to notice that yes, someone has cataracts. Yes. So basically, those are.
You want to have a question?
Yeah, I was going to ask about the changing of glasses. So if you go to the hospital, why can't they detect it from the first time?
Why
What?
can't they detect
Yeah.
Glaucoma.
Yes.
Cataract.
Cataract.
cataract on the onset?
Yeah.
Oh, it can once you have a comprehensive eye examination at the eye clinic.
Yeah, because if they give you a prescription, you wear it next 2 weeks, you come out 1 month.
Yeah, so-
means that they're not doing a good
No. So what I'm trying to say is that it is a symptom to notice that the person has cataract. When you come to the eye clinic, okay, and then a test is done for you, and you have your eyeglass prescription, you wear it. In some few months, you come back to say, no, you can't see. It is being changed for you again. You come back again. Clearly, it means it is the cataract that is causing it. And so there's no need for us to keep on changing it. Clearly,
Yes.
we diagnose you of cataract and then we look at management options.
Okay.
But a lot of people are afraid of surgery, eye surgery, cataract surgery, and all that.
Are you not afraid of surgery?
No.
Are you?
Because I've seen a lot of people go into the surgery room, come out, and they are happy. So there's no cause for alarm.
Yeah.
Yeah. But here, maybe on this show, we should try and encourage people who have cataract to explore the option of a surgery.
Yeah, but I think that should come from your doctor. Your doctor should recommend that.
Yeah.
Where the thing has reached, you need surgery.
Yeah. But people are afraid that people will say no.
Then you go blind. That one.
You see,
We have to encourage them to
Yes,
do it.
you see, with cataract, everyone and their rate of growth.
Okay.
Even though I said everyone who gets to 60 and above will get cataract. It doesn't necessarily mean that the moment you get 60, you get to 60 years, you have the cataract. It has to be.
But that's what you are saying. So you have to rephrase it. Don't say when you get 60, you will get.
Yes, everyone will. I always say everyone will get cataract. But the rate of growth is what will determine surgical options. What I mean to say is that if the cataract is not matured to a certain stage, we cannot remove it. Or we will mostly not recommend.
So right now, as we are talking, the president, president, I don't think he's 60. Is he 60?
Yes.
He has some.
He has.
Yes, he has cataract.
Ekubaro is 80.
He has it.
Kaish.
But you see,
Well, whoosh.
but you see, like I say, the cataract might have not matured. It might be incipient, very small. It might have not matured to a certain stage, which will involve surgery. You understand? So, for me, I always say everyone who gets to 60 and above
You will get
cataract. But the rate of growth is what will determine whether
Okay.
surgical options is what is important or not.
All right.
Oh, great. So I think it's a very good session. And so far, we've learned. So, Suarez, you want to
Thank you.
summarize?
Yeah,
what we've
of
learned
course,
on cataract?
of course.
I think
I mean,
it's short but enlightening.
Yes, cataract, like we all know, is ete. I don't know about the other languages, but you out there, you know your hometown, where you come from, your language. Ete, the cloudiness of the clear lens.
Right.
Sometimes you will not see well. Colors may be faded, and certain symptoms. You change your prescribed lenses for like continuously. Yes. Diabetes, it shows that you are getting it. Now, the first or the leading is age. When you get to 59, 61, doctor says you will get. Maybe it's not too grown for us to work on clinical or surgical stuff, but it is there. So all them peniphonia, they have cataract. It's manageable and it's also curable by surgery. And so, yes, you can be born with it, but when we when we see it early, we can reverse it.
Right.
So, mainly, that's it.
But Amako, do you want to add something? I think
Yes, that is a basically.
that's
So,
a good summary.
yes. And with the surgery, it's something we need to encourage everyone who.
Sometimes they do. I think sometimes they do free cataract.
Yes.
surgeries.
It is something that goes on a lot in the country. And so for me, I will encourage everyone who has been told.
Cape Coast
that-
Teaching Hospital.
Yes.
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 Other hospitals. too.
Other hospitals too have been doing it. So I encourage everyone who has been diagnosed of cataract and has been told that their cataract is at its maturity stage, which will need surgical intervention, to try as much as possible to do it. Because like I'm saying, the outcomes are mostly successful. They will just remove the cloudy lens and then replace it with an artificial clear lens. It's called an intraocular lens, IOL.
Intraocular.
Yes, lens. That's an artificial
Intraocular
lens.
lens.
Yes. So
Intraocular lens.
yes. So the natural lens in the eye is what has become cloudy.
Cloudy. So we
And
remove it
Yes,
and they
remove
put
it,
intraocular
ocular lens, which is an artificial clear lens.
Yes, and you'll be fine.
And then-
You will not see double.
You not see double good. Colors will not appear faded.
Faded.
for you. You
Yes.
understand? Lights will not appear so bright for you.
Yes.
So,
That's fine.
so that's it. I think you've learned well.
So if
Or do you
cataract-
mean by I've learned to? I knew that thing. I knew that thing already. Sure.
Yes, you did.
Yes.
But if cataract is one of the leading causes of blindness, I think there's another one I want to discuss.
Yeah.
Widely touted as the second most leading cause of blindness.
Blindness.
That's almighty
Glaucoma.
also known as the silent
Killer.
of sight.
Ah, well. So when if I ever talk at him, no.
The silent. Dr. Mark, why do they call it the silent thief of sight?
It's a very good question. You
I know because yes.
Can you tell us?
I'm telling you because when you get glaucoma, it's difficult to detect. It starts from here. It's come on. By the time it reaches here, you are gone. I know because Yvonne Nelson sang about it
Okay.
like 12 years ago.
Really?
Oh yes, you didn't know.
Which song was that? Can you
Glaucoma. I've forgotten how it sounds.
Oh, okay.
But it had John DeMello in the video, Edem, and then was featured Sarkodie. I think that's when she met Sarkodie.
Yes. So I mean, it is called the silent thief of sight because glaucoma has no early symptoms.
Okay.
You see, when your eyes are red, you can detect that, oh, my eyes are red. When your eyes are itchy, then you want to also get some medications to treat it and all. But when glaucoma is setting in, it doesn't give you any symptoms.
Okay.
That's why it is called the silent thief of sight. If an armed robber wants to come to your house, would an armed robber tell you that today I want to come and rob you? No.
But
So
then
that's
time
how-
they used to tell us totally that I'm Robert the letter more than one say and then baby out.
So as we all understand why glaucoma is regarded as the
Silent
Dr. Marco
eye
has told
stealer,
us
sight stealer.
that Dr. Marco has told us that you will not get in any early symptoms for you to know whether or not you are having glaucoma.
Glaucoma, yes. Yes.
So if you're not going to get any symptoms, how can you know that you have glaucoma?
All right. So first and foremost, glaucoma is a condition that damages the optic nerve that connects the eye to the brain. Let me do an illustration for us to.
So
What
we'll
do you
get
want
to
to
a cord
do?
right
Use
now.
me. Oh.
No, we need
You
a
use
cord.
what? Cord. Spinal cord or
So you see that is a damage, is a condition that damages the eye's optic nerve, or is a condition that damages the optic nerve from the eye that connects the eye to the brain. So let's say the optic nerve is like a cable, okay, that carries information from the eye to the brain. Now let's say this is a phone, right? And this is my cord. Now, if I want to transfer an image from this phone to the iPad, what do? I just connect it to the phone, and then same way, I connect it to the iPad.
you don't have eye drop.
You don't have hair. That's another way.
That's
Like you're
another
talking
way,
about.
but
This way.
I'm talking about this way. Now,
This way, chocolate drink.
now, so let's say this is the eye, okay?
That's why.
And the part of the eye that carries the information is the retina. And then this is the brain. So the brain will interpret all the images. Then there will be visual information. So there will be visual information being carried from the retina to
the
brain.
cornea.
To the brain. So imagine I want to transfer an image from this phone to the iPad. If there's any damage with the cord, can the transfer happen? No. So same way when glaucoma is happening, the cable is like the optic nerve. Once there's a damage of the optic nerve, there cannot be any transfer or visual information cannot be carried from the eye's retina to the brain, which is supposed to interpret all the images we see.
But
Someone
come on.
Oh,
I'm sure someone tells you.
phone to where the inca where you see over airdrop it. But if you are doing eye there, it should be eye drop. Tell me that only eye
No,
drop.
you shouldn't go. Let Suarez. Me, I like it when Suarez tries to
Okay,
explain.
yeah,
because
so let me
Okay,
see.
you know how
So,
we take the message to the streets.
Yes.
so this is the cornea, this is the brain, or retina.
This is the retina.
Well, I'm kind of straight. So if you don't have glaucoma, and you
No,
are,
and then this, the cord is what?
is the cord is the nerve.
Yes, the optic nerve.
Now
Virtual.
so if you don't have glaucoma or anything like that, if you are transferring files from the retina to the brain, it goes smoothly through the optic nerve like that, and all your files, your 39 gig pono will come here. Because the doctors moshe pono. But when you have the problem, when you have a problem, what you adding? If you have a small glitch here, and you are transferring your gospel music, concerts, and all that, and there's a glitch, it cannot be done. And that's where you realize that.
You have a problem.
Yes.
Okay. But are you satisfied?
Yes, I think it's fair. It's
Thank
fair.
you.
So the question is, if you're not going to have any early signs and symptoms, how will you be able to know if you are having glaucoma?
Okay, so mostly glaucoma is caused by increased pressure in the eye. Just like the human body has pressure, the eye also has pressure. A lot of the time when the pressures in the eye are elevated, then we want to think about the condition called glaucoma. So glaucoma in itself, there's no exact clear cause, but mostly there's a fluid buildup in the eye. And that fluid buildup in the eye is what is causing an increased pressure inside the eye. So basically, that is it.
Some of the causes of glaucoma is age.
Yes, but risk factors, first and foremost, is age.
Age, good.
Age is a risk factor.
Yes.
Then family history.
Family.
So
If family come there, curse will definitely come.
So it is not about case anyway, but if you have a family history of glaucoma, then you also have the tendency of having glaucoma.
Oh, okay.
Then those of us in the African regions or of African descent, most of us, we are susceptible to having glaucoma.
Is it because of the condition, weather condition, or our color?
Or genetic.
Genetic, basically, yes, most likely. So, and then we can also talk about diabetes.
Diabetes, number one.
You see diabetes is happening in cataract
and
it's
glaucoma.
happening with glaucoma as well, which tells us that diabetes is a condition that it really has an ocular manifestation of the eye, and so really need to be looked at when you are diagnosed of diabetes. Yes.
Okay. So how do you treat it, or how do you call it?
Even before we treat it, I am asking, why is glaucoma very dangerous? Okay, you want to answer this?
Oh, you want to?
Why do you think glaucoma is very dangerous?
If it's
As compared to cataract?
Because cataract, you can see it. When it happens, you can easily identify it, or you get notified that your sight is changing.
Okay.
Then you can report to the hospital or something. But this one, that's what they say, it's silent. You will know whether it's coming or not, or when it's coming. By the time you realize, it's too late and it might worry you.
And then
Secondly, are they?
Yes. So the simple thing is that vision loss from cataract can easily be reversed through surgery.
Yes.
But vision loss from glaucoma can never be reversed, and it's permanent.
That's where I wanted to. That's where I wanted you to know.
So
that is why, but that is why everybody must make a conscious effort to know whether or not they are developing glaucoma before it is too late. Because technically, glaucoma is irreversible. So once you get blind as a result of glaucoma, that is the end. And you can imagine living this world without having the opportunity to be able to see what you like to see. Where they are.
So what would be that? But so how do you know that you have it? How do you test for it?
That's why we said that
the pressures.
One of the reasons why initially we said that it has no early symptoms.
Yes.
But vision loss starts gradually from the peripheral vision. You know how most often than not we are focused much on our central vision, how well we see things straight ahead, but we don't focus on our peripheral vision. I want us to do a simple exercise.
Good.
Now let us all try to sit straight, and then look straight ahead. Now, as you are looking straight ahead, do you see things at your sideways?
Yes.
I can see.
I can also see. Clemento, can you see?
I can also see.
Good. But you see, when glaucoma is starting, it starts gradually from the peripheral vision, which is also the side vision. So it gets gradually. The moment it gets to the center, it starts to form a tunnel vision. Then eventually, it closes up, and then it leads to what? Blindness.
So glaucoma is about what you see, not what you are looking at. So as I'm talking to you, I'm looking here, but I can see this guy, and I can see him.
Good.
Do something, let me see.
So
you do your hand something.
Also,
what you say?
If you can see from the peripheries.
What you say?
Okay.
Anna. I say you. Yeah. So I
good.
think
So once you can see, it means your peripheral vision is intact.
Of course.
I
Thank
see
God
that.
Almighty. I will grow to be like Moses with clear vision.
Amen.
When I get to 60, I won't get cataract. Doing 40 cataract works.
So, Sora's asked something quite important. It was like, so what can we do about someone who has glaucoma?
Yes. So remember, I said that glaucoma mostly is caused by increased pressures in the eye. So when it is detected early, management options are available. Mostly we want to try and then reduce the pressure in the eye. The normal range of pressures is between 11 to 21 millimeters per mercury.
So this one, they will put a gun. I'm sure some of us have experienced it. But
Yeah,
they
I
put
haven't
a gun.
experienced.
Okay, then I think it's important you have your pressures in your eyes checked, just like you would like to check the pressures in your arms. So they put a gun in the eye. Do you call it a gun? Tonometer.
A tonometer, yes. Just use tonometer because then you have the explanation. And then
Yes. Now, Dr. Muat, we can't gun, sir.
Oh, send me I'm correcting my tonometer.
Why now? I apologize.
I'm sorry.
Yes. It's a tonometer. Tonometer.
Yeah, so you can use a tonometer.
Yes.
What he wanted to say is that there's one called an implantation tonometer. There's a handheld
Yes.
tonometer. So the gun was just
My friend. So they put the tonometer on your eye.
Yes, the tonometer is an instrument used to measure the eye pressures.
Oh, okay.
So your eye pressures are being measured using the tonometer, and then once there's detection that the pressures are high, above 21 millimeters per mercury, then we want to try as much as possible to reduce it.
Oh, okay.
Glaucoma has no cure. It is chronic.
it has to be managed.
It has to be managed.
What about that?
You can, not to cut you, but you can actually have normal pressures also and still develop glaucoma. That's what we call a
Normal tension.
normal tension glaucoma.
The telescopic thing that you put your eyes.
Slit lamp.
Huh?
It's called a slit lamp.
What does it do?
Yes, so the slit lamp mostly wants to check the anterior segment of the eye. Anything that is anterior means the front part.
Okay.
So we want to be able to assess the
You
front.
have anterior, peripheral,
So you have anterior and then posterior.
posterior,
Posterior means what?
after.
Behind.
Behind.
And I say after the eye.
Yes, behind.
I mean, if you name post, maybe
And then
post
anterior means
is
what?
before.
So can you mention some of the parts of the eye that are the anterior segment?
Lens.
Good. What else? What else?
The retina.
No, the retina is posterior.
Yeah.
But I think when doctor was also talking, he mentioned the some fluid in
Yes.
the eye that builds up.
Yes. That is the fluid that gives you
Increase the
glaucoma.
pressure.
Yes, that increases the pressure.
So when
sometimes
it proves your baby, when you glaucoma,
But
no.
on your boy.
When it proves that, then
Is it right?
No.
and when it proves, I won't go check. Is
No,
it shouldn't
you
be the reason why you're
remember, we said glaucoma has no
Early symptoms.
early symptoms,
Yo.
and I said unlike redness, where when there's inflammation, you want to situate it with conjunctivitis.
Yeah.
If there's itchiness,
Conjunctivitis is Apollo.
if there's itchiness, you want to situate it with forms of allergy. Something coming into contact with the eye that the eye doesn't like. That's why your eyes are itchy. But glaucoma has no early symptoms. So if you are tearing up, it doesn't mean you have glaucoma. But you see, these days, as much as possible, or these days, we do a lot of strain. Do a lot of screen time. So some physical activities can increase the pressures in the eye.
There's also room for surgery in glaucoma anyway.
Okay.
Isn't
At
it?
what
Yes,
point?
but
Trabeculectomy.
At what point
But
do you have that room?
basically, but we are saying that there's a mesh that's supposed to help you drain the fluids.
Okay.
Sometimes it's blocked.
yes,
So they try
either
but
laser
those ones
treatment, surgery, but the most commonest, which we normally would do, is to reduce the pressures,
Yes.
which is the use of anti-glaucoma medication, eye drops, to reduce the pressures. Right. So, Clemento, early detection is key for both cataract and glaucoma.
Glaucoma.
That's why we encourage regular eye exams, at least twice a year, every 6 months. Just walk into an eye clinic, do a comprehensive eye exam. You never know. Let them check.
People are very conscious about HIV, AIDS, and all those things, but they don't do eye.
Yes, they don't.
If you ask me, is suicidal if there is a family history of glaucoma and you've never had your eyes examined.
That's if you know.
That's if you know. But even if you don't know, there's nothing wrong, like Dr. Marco said, walking into an eye clinic.
Oh yeah, that one there. But you saying it's suicidal. No, I mean, if you don't know, it's not. Yes,
it's pardonable.
Yeah, but once you know that there's.
But now, after listening to health quarters today, it's unpardonable not to go and have your eyes checked.
That one is key. I'm talking about knowing family history.
The family history.
Yeah. If you know that your mother had some and you have up to now you've not checked, that's when we are saying you are just being suicidal. If your great grandfather has had it before, once you've had a history of it in your family, you are likely to have
but
it.
Sometimes you are the one going to start it.
Yeah, sometimes too.
Yes.
So you have to go and
regular checkup. Yeah. At least twice a year.
At least twice a year.
Then biannual. Yeah. 6 months, 6 months.
That's wonderful, Dr. Marco. So do you have last words for us? For us also, just like he summarized the cataracts beautifully. Summarize glaucoma beautifully.
Yes, so glaucoma generally as is considered as the silent thief of sight. What we are also trying to say is that vision loss in glaucoma can never be reversed. So let's not take chances. Let's try as much as possible to visit the eye clinic. Just do a regular eye exam. Check your pressures. Check.
Now they can come to you.
Oh, yes.
When they come in the name of health quarters, you give them discounts.
That is not an issue.
What's that?
Mayor advocacy.
Mayor
advocacy, mommy. Everyone was a followers.
And you only 2,000 will be about.
And say discount of almost 0.1.
Yeah. I mean, we've had a very great session. And the many people are say that, especially glaucoma. Glaucoma, I'm saying, when you are quite on the verge of going blind because it has stolen everything while blocking the beyond what they're doing. So it's difficult for you to reverse that. That's why it says it's not reversible. So yeah, you should take your screening very seriously. Even today, once you finish watching, go and screen your eye and see.
Go and check the pressures.
Check the pressure as well. And then, and you can after watching it, you can go and watch Yvonne Nelson's song. It's Yvonne Nelson with All Stars. It's called Glaucoma. It has like Beadem, Sarkodie, Sheriff Agunu, Irene Logan. It's a beautiful song. Sarkodie says, "Sell bet Tama Glaucoma de Pom 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 all night." Why do you grass is every day? So yeah, I mean it's very serious too, and it's true. Pom Pom all night, pie. Will be okay. When if with glaucoma,
good.
It can never be reversed.
So early detection is key.
Yeah.
Once detected, it can be managed without going blind.
And this one, there are no symptoms.
Yes, there are no early symptoms.
You cannot see the symptoms. No. But when right. So if you are a regular checker, you are likely to find it, or doctors are able to detect and then they work on you.
Right.
This has been a very good session. And thank you so much.
And glaucoma in 3 years then?
So some people say a hintanifra.
A hintanifra. A hintanifra. A tete baby. A hintao. But I know a near fra.
Yes.
Because that is true.
It's a silent sight, thief of sight, or sight stealer.
Right.
This has been a very educative session. We've done cataract, we've done glaucoma. Please do not take your eyes for granted. I mean, you are now seeing, you are enjoying life. If you play with it, you are gone. Your life, darkness, especially with glaucoma, complete darkness till you die. And so please do not joke with it. Get your eye screened whenever you can get the chance, or twice a year at least. Do that for us. If you're aging, 60 and above, you are likely to have cataract. So you work on that. If it's a family issue, there's a family issue of glaucoma. Please, you are the MVP for me. You are my most important person because you are likely to have it. Just get it checked and then let's have it. Let's have a free world, a beautiful world. So this has been Health Quarters Ghana with our man, Dr. Amwakon, the brother of Ashanti Regional Minister by force. And then the chief doctor, Gideon Asan. And then the great doctor of all doctors, Clementus Suarez. And this is coming to you from the 2065 Boulevard, Westland. Health Quarters with Core Media. Keep it locked.